vitamin A deficiency or A hypovitaminosis. It is a chronic disease caused by a lack of retinol or its provitamin, carotene in the body. It most often occurs due to a deficiency of vitamin A in the diet or inhibition of its absorption from the digestive tract. The disease occurs in adults and young animals of all species. The etiology of the disease can have exogenous and endogenous causes. The main reason of the exogenous disease is insufficient supply of vitamin A or carotene with feed. In young animals with milk or colostrum. It develops mainly during the stall period, due to the lack of carotene. Rich in carotene and vitamin A is carrots, green mass, hay, high-quality silage, yellow corn. The disease also occurs when there is a deficiency in the diet protein, sugar or fat, cobalt, zinc or iodine. Contributes to the disease of use rancid fat, chemical preservatives, long-term cooking of feed. The disease also occurs as a result of destruction of carotene by nitrites and other antivitamins. The cause of endogenous disease is chronic diseases of the gastrointestinal tract, liver diseases, hyperthyroidism, which contribute to impaired absorption and metabolism and, as a consequence, a hypovitaminosis. In most species, vitamin A and carotenoids are absorbed in the small intestine. Vitamin A is stored in the liver, with small amounts in other tissues and organs mostly. Cattle are known for their relatively inefficient conversion of beta-carotene to vitamin A. A significant portion of ingested beta-carotene is absorbed intact and deposited in adipose tissue and milk, contributing to the yellow color of fat and dairy products. Similar to cattle, sheep and goats convert beta-carotene to vitamin A in the intestinal wall, but generally with higher efficiency than cattle. Their fat and milk tend to be less yellow. Monogastric animals such as horses, pigs, dogs, poultry, convert beta-carotene to vitamin A much more efficiently than ruminants. Most of the ingested beta-carotene is converted in the intestinal mucosa. Cats are unique among common domestic animals because they cannot efficiently convert beta-carotene to vitamin A. They lack the necessary enzyme activity, specifically, insufficient beta-carotene 15-foot monooxygenase activity, to cleave the beta-carotene molecule effectively. This means cats require preformed vitamin A, retinol, in their diet. Vitamin A is essential for the regeneration of the visual purple rhodopsin necessary for dim light vision. Inside the retina, vitamin A is converted into a molecule called retinol. This retinol combines with a protein called opsin to form rhodopsin. When light hits the retina, even in dim conditions, rhodopsin absorbs it. This causes retinol to change shape, triggering a signal that travels to the brain, allowing you to see in the dark. With vitamin A deficiency, ability to see in dim light is reduced because of interference with regeneration of visual purple. With vitamin A deficiency, ocular abnormalities occur because of disruption to ocular, retinal, and optic nerve development from mid-pregnancy onward. Vitamin A is necessary to maintain normal position and activity of osteoblasts and osteoclasts. In case of deficiency, there is a delay in bone growth. Also, vitamin A is essential for the normal differentiation and maintenance of epithelial cells of the body. Deficiency causes keratinization of epithelial cells. Vitamin A deficiency leads to atrophy of all epithelial cells. A severe vitamin A deficiency is associated with alterations in immune function. Vitamin A is essential for organ formation during fetal growth. Animals whose maternal diets were deficient in vitamin A have been shown to have numerous congenital malformations, such as eye lesions, blindness with dilated pupils, nystagmus, weakness and incoordination, in calves, piglets, congenital hydrocephalus, in rabbits. The major clinical findings of vitamin A deficiency is night blindness is the earliest sign in all species, except in the pig, in which it is not evident until plasma vitamin A levels are very low. Xerophthalmia with thickening and clouding of the cornea occurs only in the calf. In other species, a thin, serous mucoid discharge from the eyes occurs, followed by corneal keratinization, clouding and sometimes laceration, and photophobia. A range of ocular deformities, including cataract formation, lens luxation, icrophthalmia, and reduction in the size of the optic disc, occurred in calves with low serum vitamin A and E concentrations. Skin changes are most often found in hypovitaminosis A. A rough, dry coat with a shaggy appearance and splitting of the bristle tips in pigs is characteristic. A seborrheic dermatitis can be observed in deficient pigs but is not specific. Heavy deposits of bran-like scales on the skin are seen in affected cattle. In calves is characterized by alopecia, severe hyperkeratosis. Dry, scaly hooves with multiple, vertical cracks are another manifestation of skin changes and are particularly noticeable in horses. Loss of reproductive function is one of the main causes of vitamin A deficiency. Both the male and female are affected. In males, the number of motile, normal sperm decreases. In the female, placental degeneration leads to abortion and the birth of dead or weak young. Dairy ewes fed a diet low in vitamin A have an increased susceptibility to mastitis. We observe the following changes in the nervous system. Paralysis of skeletal muscles caused by damage of peripheral nerve roots. Encephalopathy caused by increased intracranial pressure. Blindness caused by constriction of the optic nerve canal. These defects are most common in young, growing animals. They have been observed in all species except horses. Laboratory tests include determination. Plasma vitamin A. Plasma carotene, only for adult cattle, and hepatic vitamin A. Treatment. Animals with curable vitamin A deficiency should be treated immediately with vitamin A at a dose rate equivalent to 10 to 20 times the daily maintenance requirement. The response to treatment in severe cases is often rapid and complete, but the disease may be irreversible in chronic cases. Calves with the convulsive form caused by increased cerebrospinal fluid pressure will usually return to normal in 48 hours following treatment. Cattle with the ocular form of the deficiency and that are blind will not respond to treatment and should be slaughtered for salvage. Prevention includes the use of green forage. Provide fresh, green pasture for ruminants like cattle, sheep, as the primary natural source of beta-carotene. Quality roughage. Use high-quality, properly cured green hay as silage when fresh forage is unavailable. Yellow corn. Include yellow corn for some non-ruminants, though often insufficient alone. Processed feeds. Include preformed vitamin A, retinyl esters, in commercial feeds for poultry, swine, and other monogastrics.